Okay, now it's on. Hello, everybody. Bonjour. Welcome to the Health Minister's meeting press conference. Today, we're going to be hearing from the Honourable Mark Holland, Federal Minister of Health, the Honourable Yara Sachs, Federal Minister of Mental Health and Addictions, the Honourable Michelle Thompson, Minister of Health and Wellness, and the Honourable Brian Comer, Minister of Addictions and Mental Health. We're also joined today, maybe not, okay, never mind. Après les remarques des ministres, il y aura une période de questions pour les médias. On va maintenant commencer avec notre premier orateur, le ministre Holland. La parole est à vous.
C'est un grand plaisir d'être ici aujourd'hui pour une réunion vraiment productive avec mon homologue provincial et territorial. Et c'était vraiment une réunion excellente avec vraiment un esprit de coopération. Et ça, c'est absolument essentiel pour la transformation de notre système de santé parce que la situation actuelle, c'est évident que ce n'est pas durable et ce n'est pas acceptable. Et ça, c'est la raison pour laquelle on a fait d'actions communes et c'est la raison pour laquelle aussi nous sommes ici aujourd'hui. And it's a tremendous pleasure to be here in Halifax. And I want to thank both Brian and Michelle for an incredible job hosting us here in Halifax. You know, I take us back, Mark McLean hosted us in Charlottetown just over a year ago. And I think it's important to reflect on the important progress that we've made together at that period of time. You might recall at that press conference about a year ago, the questions were, are you going to be able to sign bilateral agreements on working together and aging with dignity? Is anybody going to sign up for the dental care plan? Are you actually going to be able to have any health professionals who are going to be delivering those services? And of course, pharmacare was a very distant possibility, the idea that it would be making it through Parliament. And I think it's worth reflecting today that not only have we signed with every province and every territory tailored bilateral agreements that begin to flow over 10 years, that $200 billion, we've done so in a way that really demonstrates our collaboration and the willingness to work together, respecting jurisdiction, but recognizing that we have to be shoulder to shoulder in the fight that is transforming our health system. Because the reality is we cannot afford the status quo. And I think there's a tremendous consensus on that fact. The amount of disease and illness that is preventable, around 70% of chronic disease and illness is preventable. We have to be upstream. We have to be avoiding costs. So a lot of people say to me, why are you spending so much time on dental care as an example? Well, because dental care is primary care. The number of doctors that dentists or denturists or dental hygienists that I talk to that are identifying oral cancers or identifying diabetes or hypertension are playing a critical role along with all health professionals. And we know that we're in a time where the crisis in health workforce is so evident. But as well that we're making real progress. These bilateral agreements, and I would point to the Kai-Hai report that came out that was before the bilateral agreements were signed, that showed both in terms of surgical wait times, in terms of doctors and nurses, that we're making huge progress. I'm also really pleased today at the last health ministers meeting, we made a commitment to do a joint study on education, training, and distribution of health workers in Canada. This is critically important so we can get a clear picture of what's happening in our health system numerically to be able to show what the gaps are, how we're going to close them, and be able to demonstrate how we're working together to do that. I want to say that on pharmacare that we continue to have very good conversations. I'm looking forward in the coming days to be signing agreements and talking about the reality of getting those drugs in people's hands. And just like dental care, it's an essential part of that path towards the transformation that we need to make as a health system. Making sure that somebody can get their diabetes medication isn't just a matter of social justice. It doesn't just matter because it's fair to that person who has diabetes that they can afford it. It also fundamentally is going to reduce costs and reduce illness. Waiting for somebody to get sick. And I can tell you, talking to doctors, when they give somebody a diagnosis of diabetes or they're trying to help them manage their disease and they can't afford their medication, how frustrating that is for a physician or for a nurse or for any health professional that's talking to them, to know they're going to come back with a much more serious illness that's going to cost the system much more money. It's a bananas way to do things, and we've got to change. We also had a great opportunity over the last 2 days to talk about the Canada Health Act. And I recently was able to introduce an interpretation letter that empowers provinces to be able to ensure that all professions are working at top of scope. Of course, it is the jurisdictions themselves that determine that scope of practice, but working collaboratively to be able to ensure that people aren't being charged for those services in the first order. And secondly, that provinces have the flexibility, whether or not it's a nurse practitioner, a midwife, or a pharmacist, or any registered health professional. I know that I share the desire of all my colleagues, federally and provincially, that everybody can practice at the top of their scope. We also had an important conversation around virtual care. It's essential, obviously, that provinces and territories be able to have virtual care, remote care as a part of their suite of tools that's expanding all of the time. And we have to talk about how we continue our collaboration in that space. For me, let me say, whether or not you walk into a physical doctor's office or a virtual one, it's absolutely essential that a patient doesn't pay. And so when we talk about flexibility and working together, that fundamental principle of the Canada Health Act cannot be lost. I also want to talk briefly about digital health and health data. The bilateral agreements have seen us made huge progress on creating a more interoperable system, making sure that our systems can communicate, that we can share data and use it to maximum advantage, but we have a lot further to go. And I want to place a marker here. We had C-72, a Connected Care Act legislation. There is no reason for conflict. I am not aware of anybody who has any opposition to this bill. We need to pass it, and we need to do it in this Parliament. And when you look at Europe, which already has an interconnected data system and ecosystem, they're going to be able to deploy tools like AI and other technologies that are going to have them explode their ability to deliver care for patients and be able to be upstream, identifying early, and be more intelligent with things like screening. It would be crazy for us not to take advantage of these opportunities. And I really want to commend health ministers on their shared commitment to work together with us on that. That included today approving a pan-Canadian guidelines for AI. Overall, this is part of our continued effort, shoulder to shoulder, to work within our jurisdictions in a spirit of partnership, to focus on what we agree on, what we can do together, and what we can make happen. Because I'll end on this note. We have a tremendous Canadian advantage, and it's one that we have to keep growing. We have the second longest health span of the G7. That is 1 year longer than Italy, 1 year longer than France, 2 years longer than the United Kingdom, 6 years longer than the United States. And what do I mean when I say that? Those are years in health and productivity. And if alongside of GDP, we're not measuring health span and health outcomes, then we are really making a huge error. Not just because it's essential for people to be able to live lives full of health and joy and productivity, but also because the cost of the alternative to our economy and to economic growth is utterly unacceptable. So pushing that advantage, continuing the Canadian advantage in health span is so important. We want to make sure that everybody, for their last 10 years of life, are spending it as my mom is, and I talk about her all the time, going tailgating at Bills games, going out and living her life to the fullest, still working as a psychotherapist. If you choose to, you should be able to spend those last 10 years of life however they feel good to you, not in disease and sickness. And that is something that we can do together to make sure that Canada, in every province, in every territory, is the best place in the world in which to live a healthy, productive, and very long life. With that, it's my great pleasure now to turn it over to my colleague and friend, Yara Sachs.
Thank you so much, Mark, Minister Holland, colleagues. It's really been a privilege to spend the past 2 days with my provincial and territorial colleagues. And it's clear that every single one of us here is committed to ensuring the best possible health services for Canadians. And this is a formidable and ever-changing challenge in the environment that we're in, particularly when it comes to mental health and substance use. Il s'agit d'un défi formidable et changeant, en particulier lorsqu'il s'agit de santé mentale et de consommation de substances. We know from speaking to families and communities across the country that the past several years have been difficult. Daily stresses, like the rising cost of living, are combined with global concerns such as war, climate change, conflict, and it's taking a toll on our mental health, particularly with our young Canadians. Young people have been hit particularly hard, and with many finding it difficult to access the supports that they need when they need them. And I say this not only as minister, but as a mother, that I've seen firsthand the mental health struggles facing our kids as they grapple with new realities in an ever-changing global environment. Les jeunes ont été particulièrement touchés, beaucoup d'entre eux ayant de mal à accéder à l'aide dont ils ont besoin. And I know as ministers, we share these challenges and we are working in partnership collaboratively to address them. As you know, we now have the working together agreements, as Minister Holland mentioned, that are in place in every province and territory. Just over a year ago, we weren't sure that that would happen, and here we are working together. And we're seeing the results. Just a simple example, the number of integrated youth services sites in Canada has grown over the past 2 years from 63 to 92. These sites offer a one-stop shop for youth to access health and social services, really meeting our kids where they are at in spaces that speak to them and also answer their needs. Efforts like these are complemented by a number of federal initiatives, like the $500 million Youth Mental Health Fund, the largest investment that we have made in youth mental health in Canadian history. This will be an incredible generational shift in building the resilience of our young Canadians. We want to ensure that they can get the supports and services that they need right in their communities by the organizations that they trust the most. And trust is everything. We know this as parents, we know this as teachers, we know this as mentors and community leaders. Building that trust, building that foundation of resiliency is really the goal that we want to see here for our youth, because when they thrive, Canada succeeds. But at the same time, I want to recognize that communities across the country are experiencing the tragic impacts of the overdose crisis. No community has been left untouched by this, and we know that it's the dangerous, illegal, synthetic drug supply that is costing lives. And as we go from community to community that is dealing with the tragic loss of loved ones, we also know that some communities have been disproportionately affected by this. That's exactly why in Budget 2024, we introduced the Emergency Treatment Fund to support municipalities and Indigenous communities in a rapid response to their emerging needs. For people who are struggling with substance use, we want to support and continue to support access to a range of treatment and harm reduction programs to meet people where they are in their journey to recovery and beyond. Through the Substance Use and Addictions Program, we're providing time-limited funding to community organizations who really are doing exceptional work on the front lines of the public health crisis. And a shout out to every healthcare worker on the front lines in communities that are meeting people where they're at with naloxone, meeting people where they're at in their moment of being their most vulnerable as they struggle with substance use and addiction. We see you, we hear you, we know the work that you're doing every day is critical in saving lives. We're also investing in prevention and education efforts. It's a full continuum of care that we're looking at as a federal government. And through the Youth Substance and Substance Use Prevention Program, we're using internationally recognized programs such as the Icelandic prevention model, because we know that when we want to prevent substance use and harms with our young people, it comes down to community. It takes a village. When we engage our young people within those community settings by offering them a sense of support and connection, we often say, myself and also Minister Haidu, the opposite of addiction is connection. When we create those bridges for young people to be seen and to be part of the communities that they live in, we can really make sure that that prevention stream works and that they're getting to be their best selves. But I want to turn to the work we are doing to curb the flow of illegal drugs in our country. It is top of mind to Canadians right now. Health Canada plays a critical role in supporting Canadian law and border enforcement in countering the global synthetic drug threat. To help law and border enforcement detect and address fentanyl and its precursors, we are creating a Canadian Drug Profiling Center to expand drug testing capabilities and deliver quality forensic information and services to law enforcement agencies. We're also launching the new Precursor Chemical Risk Management Unit. This will strengthen our regulatory controls for precursor chemicals and distribution channels, enhance our monitoring and surveillance, and enable timely law enforcement action to keep communities safe. We will continue to support a full continuum of evidence-based actions and innovative strategies to stem the flow of illegal drugs in our country and at the border. And when it comes to mental health and substance use issues, let me be clear, there are no quick fixes to this. And let me also stress how important, critically important, it is that we cooperate over the long term if we are going to achieve sustained progress. The collaborative efforts of our colleagues here today to have deep discussions on the overdose crisis, on the illegal toxic drug supply, to ensure that healthcare is available to those who need it when they need it, towards treatment, recovery, healing, and wholeness, is something that is a shared priority by all of us. I want to thank all of my provincial and territorial colleagues for their collaboration and discussions today as we work to protect the health and safety of Canadians. We know that now, more than ever before, we're united in a common objective of supporting Canadians who use substances to save lives and keep our communities safe. Aujourd'hui, plus que jamais, nous sommes unis dans notre objectif commun de soutenir les Canadiennes et les Canadiens qui consomment des substances, de sauver des vies et d'assurer la sécurité de nos communautés. Thank you, everyone, and I will now pass it over to Minister Thompson.
Thank you, everyone. I will be brief. Minister Holland has done a great job overviewing some of the things that we've talked about today, as well as Minister Sachs. So I want to thank my federal, provincial, and territorial colleagues for coming. I think we've been able to showcase 3 out of the 4 seasons in Nova Scotia since they arrived on Tuesday. But really, summer is the crown jewel. So I would invite all of you to come back in the summer. So good afternoon and thank you. So it's important that we have an opportunity to gather as FPT colleagues to discuss some of the challenges, but also the opportunities that are facing each of our jurisdictions in our country. Our healthcare system is complex and issues need to be addressed at their root causes. In Nova Scotia, we're looking for new solutions to old healthcare problems, and it's incredibly valuable to have opportunities to meet with my counterparts to discuss our shared interests and really learn from one another. Canadians expect all levels of government to work together to improve our healthcare systems, and they expect their leaders to walk towards the big challenges that we face, like fixing healthcare, not away from them. When taxpayers' dollars are invested, taxpayers have the right to expect positive and corresponding change, and they deserve a better healthcare system that is going to be there when they need it. So it has been my absolute pleasure to host my colleagues here in Halifax, and I look forward to continued and productive discussions. Thank you.
Thank you and good afternoon. I just want to thank my colleagues from the federal, provincial, and territorial governments for being here today. I want to thank all of our staff who did, I think, an excellent job hosting. I know that was a lot of work that was put into this event, so thank you very much to the staff. Very thankful and privileged to be part of the conversations today with my colleagues from across the country to really discuss some complex, difficult topics as it relates to addictions and mental health care across our country. Certainly, we have some common issues that we're facing across the country, some very complex issues. There's some very interesting things and innovative things happening in various jurisdictions, which was great to discuss today. Nova Scotia, we certainly made significant commitments and investments, including commitment to universal access to mental health care. So we're using technology as our colleagues across the country to try to improve access, increasing funding to grassroots community-based organizations, which we know play a critical role within the community. So we have strong partnerships I think have been established here. There was definitely a spirit of collaborations to ensuring all Canadians get the proper and timely access to evidence-based mental health care. So it's been my pleasure to take part in this year's meeting. So thank you very much.
Thank you, ministers. We'll now get to the media Q&A. We'll start with questions in the room. If you can, please keep your questions to the health ministers meeting as the topic. Please state your name and your outlet. You'll get one question and one follow-up.
Hello, good afternoon. I'm Christy Kirkup from the Globe and Mail. Jagmeet Singh, Minister Holland, has doubled down today, saying that he will bring down the government, or the NDP will bring down the government in March. And he has also said, along with the NDP, that there is no excuse for pharmacare deals to not be in place immediately. How do you respond to that?
Well, in the first order, we have a fixed election date. It is in October, and we've got a lot to do as a parliament, as evidenced both by the pharmacare deals and the work that we're going to need to do on dental care. Dental care, as you recall, took a long time for the wheels to be put on it and get it working and working well. We have over 95% of oral health professionals that are now participating in the dental care program. It's a remarkable achievement, but it's done through cooperation. It's done through working collaboratively. That is no different on the pharmacare deals. The progress that we've seen here today and with the working together agreements are done through finding common ground, are done through respecting provincial jurisdiction, and they're done through working through the complicated issues of actually making a deal work. Look, it was incredibly difficult to get the pharmacare legislation passed through Parliament. I want to thank in particular Don Davies, who was extraordinary in working through Parliament. When we then had to work through the Senate, that was a difficult process, and it took a long time. We got out of there finally in October, and we have been working as fast as we possibly can with jurisdictions to get deals. But I would put it back to Jagmeet Singh. Like, why are you in such a rush for an election? If pharmacare is the priority you say it is, then why don't you wait till October so that we can get the business of the nation done? I think that for somebody who's a diabetes patient and needs their medication, to be stopped midway along the way of the path of getting pharmacare done makes no darn sense to me. And in terms of a trade war right now, he's saying he's open to working with us on the situation that's evolving in the United States, but he's not giving any time to do that. Right now, we don't know what that situation is. So clearly, as a parliament and as legislators, our first priority is to go down and talk with our American counterparts. We're engaged in a whole of government approach to the new U.S. administration to explain the incredible value that Canada has to them, both as a trading partner and an ally. And we're going to find out what they do. And at that point in time, there's a very strong possibility that Parliament will need to take action, and we need time to do that.
And just as a follow-up, back in June, you were talking about contraceptives and diabetes medications being able to flow as of April. So what can you commit to flowing as of April? And if so, why not meeting that kind of goal you would put in place for yourself?
Well, yeah. So, there's going to be some agreements announced very soon. And when we announce those agreements, then I can give you that level of precise detail. But let me say, BC isn't here, but I'll pick on them because they were the first to make contraceptives free. It costs about $25 million. They're already saving more money than it's costing them for the program. That's how powerful it is to get people the drugs that they need. So there is such a compelling case to get this done. But it's important that we do it right and we do it collaboratively with provinces. We're going to have these deals very, very soon. When that happens, then we'll be able to show exactly when those drugs are flowing. But we're moving as fast as we possibly can, notwithstanding, obviously, there's a lot of things happening in the world right now that are trying to pull our attention in lots of places. But people's health is too important to lose sight of. We have to continue pushing.
Hi there, for Minister Holland. It's Lindsay Armstrong with Canadian Press. Understanding that you're supporting Chrystia Freeland in the leadership race, I want to know what you make of the fact that her team is not committing to a universal pharmacare program.
Well, I can say that I've talked with Christia, obviously, about the continuance of the pharmacare program. We have this parliament where we have an opportunity to get this done, and we're going to get it done. And I'm certain that there'll be support to continue that. I think the question of, what we're going to run on in the next election, well, that depends on how much we're able to get done before it happens. And so my preoccupation is on getting these deals signed.
With that, a question to any of our provincial or territorial ministers. Given the state of things, do you feel that cutting a pharmacare deal is worth it given the impending leadership race and eventual election? To any of the provincial
I
or
got to go out on a limb and say that that's look how let me just talk about where we are today. Tomorrow's a promise to no one. And the challenges that are faced in our healthcare system demand our immediate attention and action. And, right now we have a jurisdiction in Ontario that's in an election. That's part of our democratic process. But I think that constituents expect when they elect us not to get close to an election and stop working because one is approaching. We're supposed to work until the last day we're given, and then we get an opportunity to campaign. And you will hear every time I come to the microphone, I'm talking about the work we're doing today, what we're driving to change in the immediate future, and how we're using the roles that we've been so fortunate to be given to be able to serve Canadians. And so I'm often, whether or not it was House Leader or now as Health Minister, saying that the politics of the election, it's going to happen. Like, we're going to have a conversation about what we're offering in an election campaign and what a Pierre Poilievre government would do to healthcare. Like, that's all coming. But I think rightfully people should expect us to be focused on the moment that is now and working with our partners who are here now, because who knows what tomorrow holds, particularly in the world as it is right now.
Thank you. I'd like to pose that question to Minister Thompson about the closeness of a pharmacare deal.
So thank you very much. Certainly, we are in active discussions with our federal counterparts in terms of the pharmacare deal. Minister Holland and I had an opportunity to meet last week, and certainly the officials in Health Canada and in the Department of Health and Wellness are working on the details of what that bilateral agreement could look like. I think Nova Scotians expect us to do their due diligence based on the jurisdictional uniqueness that we have, and so we'll continue those discussions. But those are very active discussions that are underway right now in the province.
Hi, Heidi Petracek, Global National. A few questions for Minister Holland again. Define very soon when signing bilateral agreements, more specifically than very soon, because you are running out of runway.
Oh, I'm aware. I mean, look, I think there is runway in a couple of different quantums. One is to do all the deals that we can do immediately. This is over the next number of weeks to get as much that we possibly can done. But I'll be very clear again. I believe, and there's a lot of work to be done. So I'm not saying this to prejudice my colleagues, because there's a lot of conversation and work that would have to be done. But I'm very hopeful that we could get all deals done with all provinces given the time of this Parliament. And this Parliament was elected to a 4-year term that expires in October. So all I'm asking for is not a deferral of an election, not a suspension of Parliament, but to the time that we were given by voters to get the work done. So hopefully that's about as much specificity as I can give you.
And I do have a question on behalf of a colleague about measles, which may have come up at the meetings. Just wondering how much you're encouraging jurisdictions to take extra measure to make sure kids are vaccinated against measles, considering the outbreaks in Ontario and Quebec.
Mis and disinformation is an existential threat to public health. We can have the best solutions, the best guidance, the best tools, but if people aren't adhering to scientific guidance, then we're going to have extremely bad outcomes. It is a deep and profound tragedy that we're seeing the rise in measles cases that we're seeing. It is completely unnecessary. If you have both doses, the likelihood of you contracting measles is near nil. These are diseases that we virtually had wiped out: measles, mumps, rubella, polio. And suddenly we're seeing these diseases come back because people are spreading this misinformation. Look, the spirit of the Enlightenment, listening to science, data, reason, evaluation, this is what got us where we are as a species. And moving away from that because somebody's got a Reddit post somewhere You know, in a time of fear, I get it. Like, it's a scary time. But all of us need to listen to health professionals, people who've spent their lives dedicated to studying the science and evidence that's in front of us. And if we don't, then it portends very, very bad things. So we need to speak with a united, common voice that is in no way partisan, that everybody everywhere needs to get vaccinated. It saves lives. It's been a source of miracles, and it will continue to if we adhere to it.
Hi, Mike Gorman with CBC. Minister Thompson, I got two for you. I was going to ask about pharmacare, but I'll pivot given your previous answer. Minister, given that an Ontario Health Committee has recommended publicly funding supplemental screening for women with extremely dense breasts, should Nova Scotia be looking at revisiting its approach?
So thank you for that question. And certainly that has come up on a number of occasions. We do work with the breast screening program in Nova Scotia, and we do have a high-risk screening program that's here. So we look to those experts to guide our clinical practice. So as I've said different times in the legislature, it's not for me to change clinical pathways. We need to follow the science and the evidence. And we have Dr. Sean Isles, who is an expert in this area. We have very good detection rates. I don't have them off the top of my head, but I want to assure Nova Scotians that we continue to follow clinical practice guidelines, and we'll continue to work with the breast screening program to make sure that we have the best care that Nova Scotians can have.
Thanks, Minister. And as a follow to that, there are other provinces that have been approving referrals for ultrasounds and MRIs for women with extremely dense breasts outside of organized breast screening programs. Why can't Nova Scotia do the same in the interim?
So as I said before, we have a breast screening program. It is evidence-based. We work very closely with that program. We do have a high-risk screening program, and the rates associated with the program are very good. I'm certainly happy to get you some of that information if you would like from the program. So we'll continue to work very carefully. We're not holding anything back, but we are working with those experts who understand the science, understand the process, and who are adhering to clinical guidelines.
Thanks.
Yeah.
Hi, Minister Thompson, Callum from CTV. I guess I just wonder back to pharmacare. We're hearing certainly the urgency from Minister Holland on getting a deal done. In your eyes, what's a realistic timeline for Nova Scotia? How close are you to signing off on a deal?
So, you know, we've had very candid discussions over the last couple of weeks. Minister Holland, we were fortunate enough to meet last week, and certainly our officials, based on those conversations, were able to move forward. We certainly are pleased to see that there is some flexibility in terms of the conditions around the bilateral agreements, and we want to make sure that it captures what's happening in our jurisdiction in Nova Scotia. So we are in active discussions. We understand time is of the essence, and we've both been very candid about that. So I don't have anything for you today in terms of a tight timeline, but I will tell you that we're in active discussions and hopefully more to say soon.
Thank you. And another one for yourself, and that is just wondering what the biggest issues that you brought to the table were. What stood out for Nova Scotia specifically?
Well, of course, all of us are here to brag a little bit about the things that we feel that we're doing well. And so it was really a great opportunity to talk to my colleagues from across the country and the territories to showcase some of the innovations that we've done. As an example, my colleagues were able to go to the Innovation Hub, Nova Scotia Innovation Hub yesterday, and have a chance to really look and showcase some of the incredible things that are happening here. I think it's always encouraging when we know that it feels like these challenges are overwhelming, but when we stand together, we recognize that there are a number of challenges and we have different approaches. I think the conversation around workforce sustainability and how we're going to tackle that in a pan-Canadian way, and how others we are tackling it in our provinces and territories. It's been very, very helpful for me. So the workforce, of course, was top of mind.
Thanks so much, everyone. We're going to go online with questions. Merci à tout le monde. On va aller en ligne avec les questions. À toi, Mark.
Thank you, Alex. If you're a reporter on the Zoom and wish to ask a question, please use the hand raising function. Just give it a few moments. Okay, we have a question from Alex McIsaac, CBC PEI. Alex, please go ahead.
Hi there. My question is for Minister Mark McLean. Hi, Minister McLean. I'm just wondering, out of the programs announced today, is there anything in particular you feel is of particular benefit to PEI?
Well, first of all, I think our relationship with the federal government has been very positive over the last 3 or 4 years. Our premier leads by example in talking to our federal counterparts. So again, Prince Edward Island was one of the first to sign on to $10 a day childcare. So I appreciate my relationship with Minister Holland and Minister Sachs. From a program perspective, again, we continue to work with them and have conversations on pharmacare, which has been addressed today. So again, I would echo Minister Thompson's comments about workforce and sustainability. And I think a big part of these meetings do happen after at dinner, and we talk about some of the workforce programs that we've enacted on PEI, such as the Marion Reed Grant, which helps train islanders who don't have the ability to take healthcare training in our province. So that's been a nice addition to our suite of tools to address workforce sustainability.
Any follow-up, Alex? Okay. We're
Excuse
good.
me. Sorry, I muted myself.
Yeah.
I would just like to follow up with Mr. McLean, please. You just mentioned, investing in staffing. As of course, there's a health or a medical school in the works on PEI. We already have a Masters of Nursing program, and NPs are certainly something your government has said will be part of the solution. Are there any coming investments to sort of expand the seats available on PEI for the Masters of Nursing program?
So we already have expanded our nursing program over the last 3 years. We're now up to 98 seats. I think it's about a 23% increase in our nurse practitioner and nursing education at the University of Prince Edward Island. And talking about the recent Kai report, proportionally, we've had the strongest growth in our nurse practitioner workforce in PEI, and we're very proud of that. And obviously, we've talked a lot about our patient medical home model that we've implemented on Prince Edward Island. So our nurse practitioners are such an integral piece of delivering collaborative care. So the interpretation letter, again, it will help us encourage to continue to have those conversations with the nurses union and our clinicians, and how we integrate more and more nurse practitioners into our collaborative care model on Prince Edward Island.
Thank you, merci. On n'a aucune autre question sur le Zoom, alors la conférence de presse est maintenant terminée. This will conclude today's event. Thank you again for joining us, and have a nice rest of the day.